Hi, I'm Dr. Gito, Doctor of Chiropractic and Functional Nutritionist. In this video, I want to show you how this one very common but often missed health condition can be wrecking your life without you even knowing it. I want to show you how to find it and how to fix it. Research studies show that over 43,000% of the population, or about 127 million people, have this disorder, and most people don't even know it. Studies show that over 600,000 knee replacements and 400,000 hip replacements, correcting this one condition in early stages could drastically reduce the need for these surgeries. In fact, this disorder is a chief cause in back pain, like hip pain, knee, foot, and neck pain, knee and hip replacements, plantar fasciitis, and even spinal arthritis and scoliosis. It is the most overlooked condition by medical doctors, physical therapists, nurses, acupuncturists, and other healthcare professionals. Now, what is this condition? This condition is what's called a short leg syndrome. What is a short leg syndrome? Well, studies show that people with a short leg syndrome will have about 80% chance of having knee arthritis and 20% more likely to have hip arthritis. It is a common disorder found in many children and adults with scoliosis. So this is why early detection is a must and why we check every child and adult for the short leg syndrome. Okay, so this is the short leg syndrome. There's two different categories and they create a chain reaction. One is called the functional short leg and the other is called an anatomical short leg. Let's talk about the functional short leg first. Okay, so what a functional short leg represents is most of the time there's a falling or flat arch on one side. So we're going to take a look at this as letter A. So what happens in letter A is the arch flattens and rolls over towards the inside of the foot. It creates a stress or turning of the shin bone inward, and then the hip bone or the femur bone turns inward also. Now this puts a lot of stress on the knee and also on the hip, where the hip becomes uneven. The pelvis also becomes uneven, and then the shoulder also becomes high on one side, resulting in a shifting of the skull. So you have a functional short leg, which actually is caused by a flat arch in one or both feet, creating a chain reaction throughout the spine. The other type of short leg is called an anatomical short leg syndrome. And this is where either the shin bone or the thigh bone is actually anatomically, or the bone is actually short itself. As a result, the hips become unlevel, the pelvis becomes unlevel, as you see in letter C, and then again, the chain reaction to the shoulder becoming high on one side, and you have a tilted head in many cases. So we have two different types of short leg syndromes and a chain reaction that develops. Okay, so when the arch of the foot collapses, you have a lot of stress on the ankle and foot, and it creates a turning of the ankle inward, causing a lot of stress on the foot, a turning in of the shin bone, causing stress on the knee, turning in of the thigh bone, causing stress on the hip. And then also what happens on the long leg side, what could happen is it begins to flatten the arch, and the arch becomes collapse on the long leg side on an anatomical short leg. So you have this chain reaction going on, creating a lot of stress within the spine and the nervous system. As a result, when the arch collapses, it predisposes someone for plantar fasciitis or heel spurs. Also, the knee becomes very stressed and you get knee conditions, meniscus damage and knee arthritis, which can lead to knee replacement. So a short leg syndrome caught in the early stages can help prevent these conditions from occurring. Now, also with a short leg syndrome, the hip and pelvis can be abnormally stressed. We get wear and tear on the on the hip, and you get hip and sacroiliac joint disorders. So this can cause arthritis or wearing down of the cartilage in the hip area, and then we can also result into a hip replacement. So again, catching this short leg syndrome early, correcting, as we'll see in the future here in this video, we'll show you how to do that. Now, the short leg syndrome can also cause compression on the low back, nerves, and the disc, resulting in nerve pressure, which chiropractors call a subluxation, where we have a lot of nerve pressure going out from the spinal cord in between the bones to various areas of the body. And a numerous amount of different conditions can develop, mainly low back pain, sciatica, arthritis in the spine. It can cause disc pressure and herniations within the spine. And also it can cause compression in the neck because this chain reaction occurs with the nerves and disc in the neck. So short leg syndrome can get all the way up into the upper back, into the neck, causing neck pain and upper back tension. This tension could spread down the arms and even go into the hands and fingers. Also, as a result of the head being abnormally shifted, you can get tight and knotted upper neck muscles, and which creates a reaction of headaches from actually having a collapsed arch or a short leg syndrome. So someone with a short leg syndrome or fallen arches can actually begin headaches from the feet. Pretty interesting. It can also cause scoliosis, especially severe scoliosis in a child. So how do you get examined for a short leg syndrome? Well, we can obviously do that in the office, but here's what we look for. How can you tell? Well, again, if you look at on the right side, the balance side, you'll see the green line at the knees, and they're balanced, the hips are balanced, and the shoulders are balanced. In someone with a short leg syndrome, if they're looking in the mirror, looking at their posture, and you can do this on your own, you're going to see that the arch drops on one side. You're going to see the hip rotates in. Mainly, you're going to see a high hip and a high shoulder and possibly a tilted head, as we see in E. So A, fallen arches. B, knees uneven, rotating in. C, high hip. And D, high shoulders possible. And E, tilted skull. Okay, so what you want to do is check yourself for flat feet. That's a good indication you may have a short leg syndrome. And that would be more of a functional short leg, but you can have an anatomical short leg also, created by the long leg side pushing down. So you want to check in the back of the heel. You want to take a rotated Achilles tendon, can be rotated in. In children, you can detect it by high shoulders, uneven hips, okay, and a curvature of the spine. So these are different ways we can check for short leg syndrome in earliest childhood. So we have some solutions for the short leg syndrome. And let me explain to you and show you some of the ways we do it. So here's a patient. This is an x-ray of the low back and the pelvic area. We see that on the right side, patient has a lowered hip and a different leg length of 16 millimeters. This created a curvature of the spine, and we see the pelvic is lower. So what we prescribed and how we treated this patient is we did some gentle chiropractic adjustments to the pelvis and into the lumbar region or the low back region to help align the pelvis. We recommended a heel lift for the right side. We recommended foot levelers or arch supports to help support the falling arch on the right. We also gave them strengthening exercises for the low back. As you can see here, the spine is normal now, the pelvic is level, and the hips are level. And there's no curve in here. We also recommend cold laser treatment. This can help speed up the healing process of any damaged tissue. We use specific posture exercises to help correct any imbalances in the spine and the musculature. We do stretching. We recommend strengthening the core. And then what we do is we actually reevaluate the patient after. So short leg syndrome summary, if you have an anatomical short leg, it can create stress on the foot, the ankle, the knee, the hip, the low back, neck, and shoulders, even all the way up to create a headache. So short leg syndrome can affect the foot, knee, and hip and low back and create neck pain and arthritis. Major reason for knee and hip replacements, for collapsed and fallen arches, and even scoliosis. So how can you examine or get examined for short leg syndrome? One is you could do a home test. Here's a screening we have on our website, as I'll explain to you in a minute. You can do a home screening available. Here's the instructions in the top, and you can check for falling arches, knees swaying in and out, high hip on one side, shoulders on one side, or the head tilted on one side. So this is available on our website. And for more information about that, you could go to drgito.com/short leg, or if you would like to have a complete complimentary examination, you can call our office at 609-484-9300. So thanks for viewing this video. And again, if you want to do a home analysis or call us, you can go to drgito.com/short leg or call us at this number below. Thank you for viewing this video, and I hope it's been a great help.